Hey, it's Dr. Bill with just the tip of urology school. And today we're going to talk about kidney stones. This is going to be the medical management of kidney stones. Keep in mind that the geography, the part of the country that you live in, can really be a deciding factor in how many stone patients you see in your clinic. Hot, dry, desert-like conditions are the basic formation for patients with kidney stones. When you evaluate them, our job is to, once we've taken care of the initial problem, is to predict and identify precipitating events that may cause our patients to be recurrent stone formers. Remember that the more you have a patient or the patient that comes in with recurrent stone formation, he or she is more likely to form stones. So bottom line is, the longer the history, the longer the future of stone formation is going to be seen with your patient. So a 24-hour urine and assessment of kidney function is important. And the big items are to look at the pH, look at the creatinine to see if your 24-hour urine collection is even accurate. And so everyone will cheat a little bit on their 24-hour urine. Everyone knows to push more fluids. So you might find a patient who's pushing more fluids or already participating in diet control efforts. So have the patient try to do what he or she normally does, so you can get an accurate assessment of what's going on. So looking at a complete 24-hour collection by, again, assessing creatinine values and knowing the volumes of urinary output are big issues. Next, you look at salt and chloride excretion, because those will increase the excretion of urinary calcium levels. Citrate and magnesium are well-known stone inhibitors. Look at uric acid values, both in the serum and in the urine. This can predict formation of uric acid stones. Guidelines for stone management are going to include diet management, as well as medications at some point. But realize, though, that patients with stone disease, you really have their attention when they're having acute stone problems, pain or hydronephrosis or even infection. But once that event is addressed, people fall off on compliance. So you want to realize that probably the biggest, the most important impact you can have is pushing fluids, making sure that they're drinking anywhere enough to have urinary volumes of anywhere from 2.5 to 3 liters a day, depending upon what stones they form. Also, many stone formers have obesity, and we know that that is a risk factor. Dietary indiscretion, carbonated sodas, high salty foods, high food content of oxalates. Some people, or most people, after 50 years of age, are going to be on some sort of calcium supplement. That's important not to restrict their calcium necessarily. We want to have the recommended daily allowances for calcium use. If we fall under that, then patients are prone to breakdown of bones, and our body's getting calcium from our bone storage. So use the recommended daily requirements for calcium, but have them take the calcium with meals, so it's absorbed better and less likely to get into the urinary tract. I'll also understand that high protein levels and high salt intake may be an offending item. So we want to gear people or focus on more fruits and vegetables in their diets. I'm not talking about eliminating these issues. We're talking about moderation. Simple diuretics like thiazide diuretics can be used to reduce urinary calcium, and that's great for people who have hypercalciuric uh, precipitating events that cause stones. Remember that probably the most common stones we see are calcium oxalate, calcium phosphate, and just by reducing fluid intake, um, will offer some remedy. Potassium citrate is a way of increasing citrate for the stone inhibitor effect of citrate, and it also will help make our adjust our pH, make it more conducive of reducing stone formation. Uh, Steroids can be utilized when things are bad, but we don't want to use steroids all the time because of the other sequelae associated with this. Keep in mind that infection stones can occur. Struvite stones that are often seen with struvite, with urease or urea producing bacteria. So we can use medications that are urease motivated to decrease the precipitating event in struvite stones, trying to decrease the pH of the urine and attempt to inhibit struvite stone formation. Also, we look at struvite stones as a bacteria-induced stone, so it's important to monitor these patients with urine cultures and making sure that we can eliminate the bacteria with appropriate antibiotics. Cystine stones are less common form of stone, but it is seen in patients with low urinary pH or acidic pH, and keeping those patients alkalized, increasing their fluid as with all other stones, and using cysteine binding thiol drugs are really very important. Using patients in trying to encourage patients to have a heart healthy lifestyle with diet and exercise and skirting around issues of a metabolic syndrome is also protective for further stone formation. Really talking about lifelong modification, not trying to disrupt the boat with aggressive intervention that most patients will fail compliance with, and understand this is a lifelong problem that needs gentle modification and encouragement, really based on understanding the right foods, understanding foods that have acid or base pH impact, understanding the need for really pushing fluids and a heart healthy lifestyle. A lot of this is supporting patients' behavior, and that's something that many of the subspecialty areas of urology need to be utilized to impact a positive change. A lot of information, a lot of over-the-counter nutritional suggestions that are out on the internet, a lot of support information on what foods are supportive of stone health management. Interesting topic, something that everyone's going to see. Read about it and continue to grow your basic knowledge of stone formers. And we'll learn more about this specifically in other videos. But understand that this is really a behavior modification required urologic pathology. Dr. Bill, with just the tip of urology school, just starting to talk about stone disease.